Hi, this is Dr. Fuzayel Ahmed, practicing laparoscopy in Silchar. You all are welcome to my page. Today I am here and would be discussing the importance of hysteroscopy as well as laparoscopy in a case of evaluation of infertility. Nowadays the model treatment evaluation as well as the further intervention in case of in a patient with infertility, really it has been changed a lot by introduction of laparoscopy in the field of gynecology. And now, for example, if you want to evaluate a case with hysteroscopy, laparoscopy, and you have to know what are the things can be done by laparoscopy, what are the things can be evaluated by laparoscopy, what are the things can be diagnosed by hysteroscopy and can be managed by hysteroscopy. So if you are having the single setting, you are having hysteroscopy as well as laparoscopy, then many things can be evaluated in a infertile couple, particularly the female partner. So for example, if you consider the vaginoscopy, the first part of vaginoscopy, you can have a very good view of the vagina, the fornix, the upper part of the vagina, the fornix as well as the external os. Many mass, any lesion can be evaluated as well as sometimes management also can be done. Now going to the cervix, the whole of the cervical canal can be seen. Any pathology, any lesion can be made out. Then going to the endometrial cavity, where endometrial cavity you can evaluate very nicely, thoroughly any type of mass, for example polyp, any type of adhesion, for example synechia, all things can be very nicely seen and examined and even surgically managed also in the same sitting. You can have a very good view of both the osteas. So this is what you can see and you can make out, you can manage with the help of hysteroscopy. Now overall contour of the uterus, if it is to be seen, and both the fallopian tubes are to be seen, and the adnexus as well as the ovaries are to be seen, then you need the help of a laparoscopy. So here, after putting a scope in the abdomen of the patient, you can have a very good view of the uterus, the contour of the uterus, any Mullerian anomalies, any type of anomalies can be made out externally at least. Then if you want to see the external surface, the texture, the length and any of the abnormality of the fallopian tubes, again you need to have a laparoscopy in our abdomen. And then both the ovaries can be very easily seen, very nicely seen. Any types of pathologies in the ovary which may be the cause of infertility to the patient can be made out externally. The cyst the same sitting can be excised also. So management is an easy procedure, though everything is done here in minimally invasive way. But if you want the lumen of both the fallopian tube is not possible only by laparoscope to see, here you would need to do a procedure what we call is the laparoscopic or maybe with the help of hysteroscopy also laparoscopic chromopartibation is done. In this small procedure what we do, we give a dye through the cervix, it goes in the endometrial cavity, and if both the osteas as well as the lumens of the fallopian tubes are patent, then the spillage of the dyes from the lumen of both the fallopian tube is seen in the peritoneal cavity, and that can be witnessed by the laparoscopes. So this is what we call is the laparoscopic chromopartibation. So finally what I mean to say is that actually in a case of infertile couple, the evaluation of infertility where many causes are found and even the same sitting these are managed, the laparoscopy as well as the hysteroscopy should go together, and it has really revolutionized the evaluation part of a case of infertile couple. Thank you.